Hey everybody, Senator Tim Kaine here. It's a pleasure to join you by video today. I want to start by thanking SolveME and Bio for convening a diverse group of advocates to discuss this very important issue. Just a few weeks ago, I worked with the Agency for Healthcare Research and Quality to gather patients, providers, and state and federal health officials at a summit in Richmond to discuss long COVID. The conversations that day allowed us to, nearly 3 years after the onset of the pandemic, dig into long COVID and its impact on all of us. We were able to discuss our experiences, the research, what we know, what we don't know, the challenges we've faced, and the reasons to be hopeful. I'm on my own long COVID journey. My symptoms are mild and they don't prevent me from working or anything else, but they've been continuous for nearly 3 years. I got COVID in March 2020. My case was mild, and by early April 2020, I was fine, except for one lingering symptom. When I first got COVID, I noticed that all of my nerve endings were tingling 24/7. Feels like they've been dipped in an Alka-Seltzer, or like they've all had 5 cups of coffee. I didn't talk about it for a while because I thought I would wake up one day and that symptom would be gone. But that didn't happen. 3 years later, the symptoms haven't gotten worse, but that it also hasn't gotten better. I've since learned that my long COVID symptom is a significantly possible after effect of this viral infection. And while it likely won't get worse, it may never go away. I wish I didn't have long COVID, but having it connects me with people across the country who do. And I've talked to many of you and heard the very significant challenges that you're facing, including one of the most significant challenges. People feel that their symptoms are not being believed. I started sharing my own experience because people who are grappling with long COVID should know that there's somebody in the Senate, particularly somebody on the Health, Education, Labor, and Pension Committee, who believes them and is committed to working towards solutions. And we have been working with the long COVID community towards solutions. I'm glad that Congress has taken some steps forward in meeting this challenge. In December, Congress passed a budget that included $10 million for the Agency for Healthcare Research and Quality's critical research into long COVID. That was a core piece of the Care for Long COVID Act legislation I introduced with Senators Duckworth and Markey last year. Other parts of that bill were among efforts that the Biden administration announced last year to address long COVID, including policies to help connect those with disabling long COVID with critical local resources, and convening relevant agencies to learn more about how to diagnose and treat this condition. But there's a lot more work ahead to pass other parts of my Care for Long COVID Act. We have to build upon the existing research to better understand causes, treatments, and cures for long COVID, with an eye to disparities in access to care. We have to improve our outreach and education on long COVID to the general public, to healthcare providers, and to employers. And we must address disabling long COVID by improving access to social services and addressing access to Social Security disability insurance. We've got to do all this with a sense of urgency. And that's why this event and the partnership between SolveME and Bio are so important. So I want to thank you for joining today. I wish you all a productive event, and I'm looking forward to working together to address long COVID here in the United States, and if we find solutions all around the world. Thanks so much.